Hi, all. This is Dr. Martha Durham. I'm a psychologist here in Greenville, South Carolina, and we're here with another episode of Why Did They Do That? The podcast. I am thrilled today to have Dr. Stephanie Dach with me. She's an amazing OB-GYN here in Greenville, South Carolina, and she has some great news about HRT, which is hormone replacement therapy, which has been a lifesaver for me. I tell all of my medical professionals I'm going to die in my patch because it has made my life so much better. And so Dr. Dach has some news for us about that. Tell us about what's happened with HRT.
Absolutely. Thank you for that introduction. That's very kind words. So in the news lately, you may or may not have seen that the FDA finally, after years and years, has removed its black box warning against hormone replacement therapy. There's a long history behind all of that, but last week they made the decision to remove that. And in the next 6 months, we'll actually see that black box warning being removed from all hormone products for women.
That's amazing.
It is amazing. Finally, it's a long time coming. And we had a lot of work to do to re-educate patients about the benefits. There are still some risks, and it's not for everybody, but it is it's a huge milestone in my mind for women's health. Finally, many years to come.
Well, I remember years ago talking to you, and you explained to me that the warning was for a very small percentage of people who had a certain gene for estrogen-fed cancers. Tell us about that and that small group of people.
Well, that's part of it. But if you'll let me just kind of take you through the history of it all and how this all came, is that okay? So in 2002, there was a big study called the Women's Health Initiative, better known as the WHI. And the findings of that study were published and misinterpreted mostly by the media, but also by providers. The study looked at women whose average age was 63, so not menopausal range. You go into menopause at 52. And the published data and the media jumped on the findings and told people what the message was, that is, if you take hormones, you're going to get breast cancer and you're going to have a stroke and you'll die sooner. So unfortunately, very misunderstood and very misrepresented in the media. Problem number one with the study, they looked at the wrong age group. 63 is way too old. You should be starting hormones in perimenopause/menopause, 40s and 50s. Problem number two, they only used one type of hormone, synthetic hormone. They used Prempro, very popular back in the 90s and the 2000s. We pretty much don't even use that anymore. There's an oral estrogen and a very synthetic progesterone. And then problem number three, it was just misinterpreted, and they didn't analyze the data, and that message didn't get out. So what people saw and heard was, if you take hormones, your risk of breast cancer is going to go up by 25%. That's what was heard. And your risk of stroke is going to go up by 41%. In actuality, one case per 1,000 women increased risk of breast cancer in patients who took estrogen and progestin, and actually decreased risk with estrogen only. And if you really tease out the data and look at younger folks, there was actually no increased risk with those hormones, especially when looking at estrogen only. So very misinterpreted results. But out of that, for some reason, the media got onto it, and then the FDA jumped on the bandwagon and put that black box warning on all hormones, even topical hormones.
Right.
So people have really lived in fear for a very long time.
Yes. And listen, I know you're humble. You're not going to like this, but I think one of the things I love most about you is how smart you are, how much you care about all this stuff, and how you try to educate people. It's so important. And not everybody in the medical field is like you. And I know they're all wonderful. I'm not putting anybody down, but you really know your stuff, you advocate for women, and it's just so important that women who can use hormones do. Do you agree with that? And tell us why.
100%. So can I just run through some symptoms of perimenopause, menopause?
Yes.
Okay. So weight gain, PMS symptoms, decreased libido, vaginal dryness, headaches, anxiety, itchy skin, itchy ears, frozen shoulder, joint pain, midsection fat, changes in cholesterol, increased LDL, memory loss, night sweats, hot flashes, mood problems, irritability, agitation. If I told you that there was something that could help with all of those things, I think most people would say, yes, please sign me up. But fear has kept people away from hormones. And I think we finally have something objective to show people that this black box warning was a mistake, shouldn't have been used in the way it was. And now we have something to offer people. Those are symptoms. But in addition to that, one of the big things that happens in menopause when you go off that literal cliff of hormones is you stop helping your bones resorb and recreate new bone. And we know that our risk for bone fracture and osteoporosis goes up in menopause. We also know that if you're in your 60s, 65 and up, and you have a hip fracture, your risk of dying in the subsequent 3 years from all causes increases by up to 40%. So all these women who were taking off their hormones, or all these women who didn't take hormones, were not given an opportunity to prevent osteoporosis and fracture.
It feels almost criminal.
Yeah, it kind of does. So again, I guess we can't undo what's been done, but I'm very happy to know that at least that black box warning that people saw whenever they opened up their prescription for vaginal estrogen, it's ridiculous, but it's gone. So we can at least move forward and help educate people and try to really get people beyond that fear. When I tell people that the increased risk of breast cancer is only 1 case per 1,000 in the estrogen and progestin group, they're shocked because what they heard was 26% increased risk.
Right. So scary. I remember that I had people around me who were going into menopause. I was fairly young and I was watching these women, clients, friends, and the just a fundamental change they were going through. Like they would come in with their partner and the partner would say, she wants to see me dead. This is not normal. The wife would say, it's true. Like I have these terrible mood swings. I feel terrible. I'm dried up like the Sahara Desert. Your skin, your hair, everything. Back then I was saying, you got to at least look into this because my mom was on HRT. So I had an example of a mom who was on it and she was on the old stuff.
Yeah.
Well, she was on the old stuff that you're talking about.
Well, that's what we have. That's what we use. But I think what I hear, and you probably hear this because of what you do, is at first, I just don't feel like myself. I don't know what it is, but something just does not feel right. And then if you delve into some of the more specific symptoms, you can kind of narrow it down. But if you look at how estrogen works, a lot of people complain of like a brain fog, just can't really. I mean, I think maybe you and I have talked about that before. But if you look at estrogen, it increases insulin sensitivity in the brain. So your brain is better able to take up glucose. Well, if you lack estrogen and you lack that ability to take up glucose in the brain, then your brain's starving. It also increases the flexibility of the vessels in the vein. So the brain gets more blood flow on estrogen. It decreases inflammation. And it's doing all of these things. We're just talking about the brain. So you can imagine the systemic effects that estrogen can have on the rest of the body. If you're a candidate, and if you want, it's not for everybody, but at least I can explain to people that this is why you're feeling that way. And it's a true feeling and you are going through these changes.
So let's talk about the people who really can't do it. What do you recommend for them?
So for people who currently have breast cancer, we obviously do not recommend hormone replacement therapy. We are learning more and more about breast cancer survivors and the types of tumors that they have and the aggressive nature of their breast cancer. And I think in the future, even some breast cancer patients may be eligible to take hormones in the future with a very detailed discussion with their doctor about it. But let's say we have a breast cancer patient and she has gone through menopause and is experiencing these terrible symptoms. There are medications that work on the temperature center in your brain that are not hormonal that help with hot flashes and night sweats. So at least you can control that. So you're not waking up, throwing the sheets off and, in a sweat all the time. That helps with that. And then there are the class of medications that work on serotonin because that helps the temperature center in your brain. So the class of medications people traditionally refer to as antidepressants that can help with some postmenopausal symptoms. And also that irritability. Exercise is a huge, I call it the drug that prevents everything. It helps with serotonin and it helps with some of the menopausal symptoms as well.
Yeah.
One thing that I hear pretty much every day in someone who's going through this transition is they feel like they're gaining weight and it's out of control and it's in their central area. The one thing that you can do if you can't take hormones to help with that is to strength train. You talk about it all the time. You build muscle, you build bone, you prevent that osteoporosis, you help your metabolism, and you help your mental health as well.
Yeah, you're a great example of that. You do all those things.
I do all those things.
I actually have, you do. I actually have, oh my gosh, what am I looking for? An autoimmune disorder. So a lot of the things that come along with perimenopause and menopause, I already have. And so I feel like my HRT helps me in both of those areas. Like my brain is clearer. I actually am exercising all the time now.
We love that.
I'm sure you'll be happy.
We love that.
It's so good for your mood. It releases neurotransmitters. So is sunlight. And so a lot of times I'll get people to do a light box, and there is research from JAMA. So there's some real scientific research that can act like an antidepressant and that works on serotonin. So that can also boost things. What do you think about that?
Early morning light exposure is fantastic for raising your serotonin. And then if you can couple it with exercise, it's like a double whammy. So yeah. The back to the discussion about bone loss and strength training.
Yes.
We do also know now that you can actually reverse osteoporosis with certain strength training exercises. There's a big trial called the Lift More trial that looked at that because we thought in the past all we had at that point were drugs to reduce osteoporosis. But now we know there are specific strength training exercises that can help reverse osteoporosis. So
that's really cool.
Strength training in the morning, perfect.
Yeah. Are there articles or websites that you recommend for women to kind of learn this kind of stuff?
This stuff is everywhere now on social media, hence the talk that we're doing. There are many leaders in menopause who are on social media who provide good content. But then also the Menopause Society has good references there as well. The articles are numerous, but you can look up follow-up WHI and you can see the follow-up data that they've provided since the initial release.
Well, one of the things I would caution people is with social media, you'll get people without credentials that don't have good science to back up their stuff who will say things. So I think one of the keys is make sure that you're looking at a reputable site with good research, right? And for this stuff, the stuff you're talking about, I think it's easy to find, but people will also take supplements and do things that we don't know about. Are there supplements or sources of supplements that you agree with and think people should take?
I do agree with a lot of the supplements. Back to the issue about social media. So I always tell people, be careful if you are seeing somebody or talking to somebody and there is a financial gain for them prescribing a specific type of supplement or a specific type of hormone. You want to just be careful.
Yes.
That doesn't mean that it's bad, but you want to make sure that there's not a financial gain behind some of these supplements and compounded hormones.
Right. I know a lot of people say that you should really try to get a lot of the stuff in your food. And obviously that's the best way to go.
It is the best way to go. But of course, in menopause, it is harder to absorb and get the nutrients that you need. So I can share with you what I take. I take a omega-3, I take a magnesium, and I take a vitamin D. I also take a protein supplement and a collagen supplement. And my big thing now is a creatine supplement.
I take every one of those.
Okay.
Yay.
Look, we're on the same page. That's good. But I would encourage people who are listening to talk to their physician about it. This is in no way medical advice, but those are things that I take.
It's not medical advice, but this is a very well-versed physician in front of us who knows her stuff. So I will say that. Is there anything else you want us to know?
Let's see. What did we not touch on? I do hear a lot of people talk about weight gain that happens around this time. So if you look at population-based studies, you will see with age, slow creep of weight. And that is across the board, men, women, menopause, no menopause. The problem with menopause is that when your estrogen is declining, it tells your body to start storing fat, number one. Mm-hmm. So you lose lean mass, you gain fat mass. Nobody wants that. But it also tells your body to start storing it in the central portion, usually in the tummy. And I hear that all the time. It also decreases your insulin sensitivity. So you become insulin resistant. Everybody knows that from the pre-diabetic. And it makes it a little bit more difficult to gain muscle. So if you weren't going to do anything else, change nothing else, no supplements, no hormones, no nothing, the more muscle mass you have, the better your metabolism will be and the better able you will be able to clear the abdominal fat. I think that's a big thing that people are coming in for. And there is plenty of data for people who are taking GLP-1s for weight loss or for diabetes or for whatever. If you do hormones with GLP-1s, your results are much more robust because it helps with insulin sensitivity.
Oh, that's great to know. Last question. How long should people stay on hormones?
Great question. Used to be 10 years. That's it. That's all you get. No more. I think that mantra is changing. The more that we learn, the more benefits that we recognize following estrogen therapy. And I think that's a decision that can be made with a physician. But at this time, there isn't a time limit on it. I do recognize that after about 10 years of use, some of the risks that we see that were published in the original WHI in that 63-year-old population, that increased risk of breast cancer, increased risk of thromboembolic disease, i.e. stroke, heart attack, that does start to go up slightly. But I think it's very nuanced, as it should be with each individual.
Okay. Thank you. I'm
You're
so
welcome.
glad you were here.
Thank you for having me.
Oh, yeah. I hope you'll come back and talk about anything you want.
You pick topics. I'll be there.
All right. So this is the Why Did They Do That podcast. We had the pleasure of being with Dr. Stephanie Dach today. I'm so appreciative of all this information. If you guys like what you heard, please like, subscribe, and share. Thank you.
Thank you.